This is the Exam 2 review. So these basic terms on the left are from your chapter 22. They go over them in detail at the beginning of the chapter, page 295. These are just little blurbs from that on this slide. So just remember that ethics is that study of conduct and character. Is concerned with determining kind of what's good or valuable for individuals, groups, and society at large. If you go back and you listen to this recorded lecture, that would probably be a good idea. It goes over these terms in depth, but if not, just know that for the exam review, yes, definitely know and understand and be able to use these terms in practice. So when we're talking about autonomy, we use that a lot in our practice. We use that term a lot in that standard. So it just refers to the freedom from external control is basically what it is. The patient has the right to accept, refuse, or terminate care. So we have to respect our patient's autonomy, and then we have to stand up for our patients as well. So it's kind of referring to that commitment to include patients in decisions about all aspects of care as a way of acknowledging and protecting a patient's independence. So providers are obligated to inform patients about risk and benefits of treatment plans, and then to ensure that they understand and agree with that plan. The principle of, we're talking about beneficence, that is the practice of it's very fundamental to our practice. The agreement to act with beneficence implies that the best interests of those patients should remain more important than our self-interest. So we don't put what we believe first. Maleficence, it refers to harm or hurt. So non-maleficence would be that avoidance of harm to our patients. And then justice, that refers to fairness. Fidelity refers to faithfulness, and it includes the willingness to abandon patients regardless. Fidelity includes the unwillingness, sorry about that, to abandon patients regardless of the circumstances. Okay, for example, like if we're caring for a prisoner that's raped several women in the community, that's extremely difficult, right, for us to do, but we couldn't abandon that patient either. Professional Nursing Code of Ethics. We know that our American Nurses Association Code of Ethics is the profession's non-negotiable ethical standard. It guides the profession in self-regulation and informs new professionals of the expected moral behaviors. So a code of ethics can be defined as a collective statement about the group's expectations and standards of behavior. The American Nurses Association Code of Ethics is the profession's non-negotiable ethical standard. It's not legally binding, remember, but the Board of Nursing can actually discipline nurses of unprofessional behavior that results from violation of the ethical codes. It guides our profession in a self-regulation and informs new professionals of the expected moral behaviors. It is revised regularly to reflect the changes in practice. However, basic principles of responsibility, accountability, advocacy, and confidentiality remain constant. Social networks are good for getting up to date information on medications and patients' illnesses. So when does it present a risk to the patient's privacy? Well, that would be when we're posting a photo even with no identifiers should not be practiced, as sometimes the patients can still be identified. Becoming friends with patients may cloud your ability to remain objective. Workplace policies will guide your decisions in engaging with social media. You have access to patient charts with the EMR. You know a neighbor in the hospital and just want to know how she's doing. Do you pull up the chart? No, absolutely not. You're only able to pull up a chart of a patient, if they are under your care. Okay, so advocacy refers to the support of the patient, including their right to privacy and their right to refuse treatment. Responsibility refers to a willingness to respect one's professional obligations and follow through. As a nurse, you are responsible to follow agency policies and procedures and are responsible for both your own actions and actions of those to whom you delegate tasks. Accountability refers to the ability to answer for one's own actions. When we're talking about confidentiality, we think of the Health Insurance Portability and Accountability Act of 1996, which mandates protection of the patient's personal health information. Okay. So what I want you to know for chapter 23 starts here. We talk about legal implications in nursing practice. Safe and competent nursing practice requires clinical reasoning and an understanding of the legal framework of healthcare, the specific state's Nurse Practice Act, and the scope and standards of nursing care. As patient care practice innovations and new healthcare technologies emerge, the principles of negligence and malpractice liability are being applied to challenging new situations. So nurses need to understand the law to protect themselves from liability and to protect their patients. Nurses need not fear the law, but rather should view it as the foundation for understanding what society expects from professional nurses. Safe nursing practice includes an understanding of the legal boundaries within which nurses practice. As a professional nurse, you need to understand the legal limits of nursing and the professional standards of care that affect nursing practice. Statutory laws include Nurse Practice Act found in all states. The Nurse Practice Act describes and defines the legal boundaries of nursing practice in each state. The Nurse Practice Act of each state defines the scope of nursing practice and expanded nursing roles, sets education requirements for nurses, and distinguishes between nursing and medical practice. Criminal laws are meant to prevent harm to society and to prevent punishment for crimes. These are characterized as felonies or misdemeanors. A felony is a serious offense that results in significant harm to another person or society in general. Felony crimes carry penalties of monetary restitution, imprisonment greater than 1 year, or death. So examples of Nurse Practice Act violations that may carry criminal penalties include misuse of a controlled substance or practicing without a license. A misdemeanor is a crime that, although injurious, does not inflict serious harm. For example, parking in a no parking zone is a misdemeanor violation of traffic laws. A misdemeanor usually has a penalty of a monetary fine, forfeiture, or brief imprisonment. Civil laws protect the rights of individuals and provide for fair and equitable treatment when civil wrongs or violations occur. The consequences of civil law violations are damages in the form of fines or specific performance of good work, such as public service. Nursing negligence or malpractice is an example of a civil law violation. An example of a regulatory law is the requirement to report incompetent or unethical nursing to the State Board of Nursing. Common law results from judicial decisions concerning individual cases. Most of these revolve around negligence and malpractice. An example of a federal law is the Americans with Disability Act of 1990. Statutory law may be criminal or civil. A felony is a serious crime that usually has a penalty of imprisonment for longer than 1 year. At times, a felony will require the death penalty. A misdemeanor is a less serious crime that has a penalty of a fine or imprisonment for less than 1 year. Damage for civil laws usually involves the payment of a fine. Standards of care reflect values and priorities of the profession. The best known standard of care comes from the American Nurses Association. This organization has developed standards for nursing practice, policy statements, and similar resolutions. Nursing standards are also set by every state, as well as by state and federal laws that govern hospitals, other places where nurses work, and specialty nursing organizations. In a malpractice lawsuit, a nurse's actual conduct is compared to nursing standards of care to determine whether the nurse acted as any responsibly prudent nurse would act under the same or similar circumstances. Nurse Practice Acts define the scope of nursing practice, distinguishing between nursing and medical practice, and establishing education and licensure requirements for nurses. The State Board of Nursing defines the practice of nursing more specifically. Policies and procedures are specific to that facility and detail how a procedure should be performed. In a lawsuit for malpractice or negligence, nursing experts are asked to testify to the reasonableness or inappropriate actions of the healthcare staff once the patient's condition began to change. Actions are compared to the standard of care. The ADA prohibits discrimination and ensures equal opportunities for people with disabilities in employment, state and local government services, public accommodations, commercial facilities, and transportation. As defined by the statute and the U.S. Supreme Court, a disability is a mental or physical condition that substantially limits a major life activity, including seeing, hearing, speaking, walking, breathing, performing manual tasks, learning, caring for oneself, and/or working. The ADA protects healthcare workers in the workplace with disabilities such as human immunodeficiency virus infection. Likewise, healthcare workers cannot discriminate against HIV-positive patients. The Emergency Medical Treatment and Active Labor Act provides that if an emergency condition exists, staff must evaluate the patient and may not discharge or transfer him or her until the patient's condition stabilizes. Health insurance companies are required to provide equal coverage for mental health and substance abuse treatments. Living wills represent written documents that direct treatment in accordance with a patient's wishes in the event of a terminal illness or condition. A durable power of attorney for healthcare is a legal document that designates a person to make healthcare decisions when the patient is no longer able to make decisions on his or her own. For durable powers of attorney for healthcare to be enforced, the patient must be declared legally incompetent or lack the capacity to make decisions regarding his or her own healthcare treatment. DNR is an order written by the healthcare provider when a patient has indicated a desire to be allowed to die after cardiac or respiratory arrest. All healthcare staff must know whether a patient has a DNR order. The State Board of Nursing licensee all registered nurses in the state where they practice. The requirements of licensure vary among states, but most states have a minimum educational requirement. You will be preparing to take the NCLEX RN. Licensure provides legal guidelines for the protection of the public or patients. The State Board of Nursing suspends or revokes a license if nurses conduct violates provisions in the licensing statute. Good Samaritan's law protects people who offer help at the scene of an accident. All states have Good Samaritan acts. Florida does not mandate that a nurse stop at the scene. A nurse is immune from liability as long as you act without gross negligence. You should only provide care consistent with your level of expertise. If you leave the patient without properly transferring or handing him or her off to a capable person, you may be liable for patient abandonment and responsible for any injuries suffered after you leave him or her. Public health laws require reporting of some communicable diseases, specify necessary immunizations, and mandate other measures that promote health and reduce health risk in communities. In Florida, child abuse and vulnerable adult abuse must be reported to the appropriate authorities. A tort is a civil wrong made against a person or property. Intentional torts are willful acts that violate another's rights. These include assault, battery, and false imprisonment. An assault may be actual or it may result from a threatened action such as giving a person an injection or threatening to restrain a patient who has refused a procedure. Assault is an intentional threat toward another person that places the person in reasonable fear of harmful, imminent, or unwelcome contact. No actual contact is required for an assault to occur. Battery is an intentional touching without consent. False imprisonment is a tort, an example of which is restraining a patient without justification. The contact can be harmful to the patient and cause an injury, or it merely can be offensive to the patient's personal dignity. Battery also results if the healthcare provider performs a procedure that goes beyond the scope of a patient's consent. Do not perform any procedure unless consent obtains or a patient is Baker acted. Patients have the right to refuse. The tort of false imprisonment occurs with unjustified restraint of a person without a legal reason. This occurs when nurses restrain a patient in a confined area to keep the person from freedom. False imprisonment requires that the patient be aware of the confinement. Cannot prevent a patient from leaving the hospital against medical advice. Typically, invasion of privacy is the release of a patient's medical information to an unauthorized person, such as a member of the press, the patient's employer, the patient's family, or online. The information that is in a patient's medical record is a confidential communication that may be shared with healthcare providers for the purpose of medical treatment only. Do not release medical information to others without consent. Do not assume the family members know all of the patient's history. Defamation of character is the publication of false statements that result in a damage to a person's reputation. Slander occurs when one speaks falsely about another. Libel is the written defamation of character. Negligence is conduct that falls below the generally accepted standard of care of a reasonably prudent person. Malpractice is one type of negligence and often referred to as personal negligence. Certain criteria are necessary to establish nursing malpractice. Number one, the nurse owed a duty of care to the patient. Number two, the nurse did not carry out or breach that duty. Number three, the patient was injured and the nurse's failure to carry out that duty caused the injury. The best way for nurses to avoid malpractice is to follow standards of care, give competent health care, and communicate with other healthcare providers. Please refer to page 318, box 23.4, proof of negligence. A patient signs a general consent form for treatment when admitted to a healthcare agency. A separate consent is signed before specialized procedures such as surgery, blood transfusions, or research. A patient may withdraw consent at any time. The person responsible for performing the procedure is responsible for obtaining the informed consent. If a patient is deaf or speaks a foreign language, an official interpreter must be used. Family members should not interpret health information. It must be obtained and witnessed when the patient is not under the influence of medication such as opioids. It is not the nurse's responsibility to get informed consent. If patients deny understanding or you suspect that they do not understand, notify the healthcare provider or nursing supervisor. Healthcare providers must inform a patient refusing surgery or other medical treatment about any harmful consequences of refusal. Parents are usually the legal guardians of pediatric patients. Therefore, they typically are the people who sign consent forms for treatment. Patients with mental illnesses must also give consent. They retain the right to refuse treatment until a court has determined legally that they are incompetent to decide for themselves. Now we'll go over Chapter 38, Immobility. This slide brings everything together that you should know in this chapter. Remember, bed rest is an intervention that restricts patients to bed for therapeutic reasons. Nurses and healthcare providers most often prescribe this intervention. The effects of muscular deconditioning associated with lack of physical activity are often apparent in a matter of days. This cluster of symptoms is often referred to as the hazards of immobility. The individual of average weight and height without a chronic illness on bed rest loses muscle strength for baseline levels at a rate of 3% a day. Immobility also is associated with cardiovascular, skeletal, and other organ changes. The term disuse atrophy describes the tendency of cells and tissues to reduce in size and function in response to prolonged inactivity resulting from bed rest, trauma, casting, or local nerve damage. All body systems work more efficiently with some form of movement. Exercise has positive outcomes for all major systems of the body. When there is an alteration in mobility, each body system is at risk for impairment. The severity of the impairment depends on the patient's overall health, degree, and length of immobility, and age. This slide is very straightforward. We know that immobility disrupts normal metabolic functioning, and what happens is that as long as we're on bed rest, we have inactivity, we're going to decrease our metabolic rate. That's going to cause these GI disturbances, which are decreased appetite, decreased peristalsis, and with that decreased peristalsis, we're going to get constipation. The most common respiratory complications are atelectasis, that's that collapse of alveoli, and hypostatic pneumonia, which is that inflammation of the lung from stasis of pooling of secretions. And decreased oxygenation leads to increased immobility. In atelectasis, secretions block a bronchiole or a bronchus, and the distal lung tissue collapses as the existing air is absorbed, producing hypoventilation. Sometimes an entire lung lobe or a whole lung collapses. At some point in the development of these complications, there's a proportional decline in the patient's ability to cough productively. Ultimately, the distribution of mucus in the bronchi increases, particularly when the patient is in that supine, prone, or lateral position. Mucus accumulates in the dependent regions of the airways. Hypostatic pneumonia frequently results because mucus is an excellent place for bacteria to grow. So what do we do for these patients? For immobilized patients, secretions accumulate in those dependent areas of the lung. Often patients with restricted mobility experience weakness, and as this progresses, the cough reflex gradually becomes inefficient. All these factors put the patient at risk for developing pneumonia, like we said before. The stasis of secretions in the lungs is life-threatening for an immobilized patient. Interventions help to expand those lungs, dislodge, immobilize stagnant secretions, and clear the lungs. All of these interventions help reduce the risk of pneumonia, like encourage the patient to deep breathe and cough every 1 to 2 hours, teach alert patients to deep breathe or yawn every hour, or to use an incentive spirometer. Instruct the patient to take in 3 deep breaths and cough with a 3rd exhalation. Chest physiotherapy, percussion, and positioning is another effective method for preventing pneumonia and keeping the airway clear. CPT helps the patient drain secretions from specific segments of the bronchi and lungs into the trachea so he or she is able to cough and expel them. Ensure that patients who are mobile take an adequate fluid intake to thin secretions. Unless there's a medical contraindication, an adult needs to drink at least 1,100 to 1,400 milliliters of non-caffeinated fluids daily. So orthostatic hypotension is a drop of blood pressure greater than 20 millimeters of mercury in systolic pressure or 10 millimeters of mercury in diastolic pressure, and symptoms of dizziness like headedness, nausea, tachycardia, pallor, or fainting when the patient changes from that supine to the standing position. The leg muscles normally contract and compress blood vessels to promote blood flow with walking or running. In the immobilized patient, decreased circulating fluid volume, pooling of blood in those lower extremities, and decreased autonomic response occur. These are especially evident in the older adult. As the workload of the heart increases, so does its oxygen consumption. Therefore, the heart works harder and less efficiently during periods of prolonged rest. As immobilization increases, cardiac output falls, further decreasing cardiac efficiency and increasing workload. Patients who are immobile are also at risk for thrombus formation. A thrombus is an accumulation of platelets, fibrin, clotting factors, and the cellular elements of the blood attached to the interior wall of a vein or artery, which sometimes occludes the lumen of the vessel. A thrombus can be caused by slow blood flow in calf veins associated with bed rest. Immobilized patients have an increased workload on the heart. They can experience orthostatic hypotension, and they can experience thrombus. Reducing orthostatic hypotension, we want to mobilize those patients as soon as they are able, even if only dangling feet at the bedside or ambulating to a chair. Move from a sitting to a standing position slowly. When we're talking about reducing cardiac workload, we want to instruct our patients to avoid using a Valsalva maneuver when defecating, moving up in bed, or lifting objects. When strain is released, increased blood pressure causes reflex bradycardia that can result in sudden cardiac death in patients with heart disease. Breathe out while performing these actions is what we need to teach our patients. Preventing DVT, which remember is a never event, we want to aggressively teach them and have them do prophylactics. Early ambulation, leg, foot, and ankle exercises, SCDs, TED hose, anticoagulants may be ordered. Teach the patient to avoid crossing their legs, massaging the legs, and sitting for prolonged periods of time, because this puts pressure on the posterior knee and deep veins in the lower extremities. Remember, muscle atrophy, disuse leads to decreased muscle size, tone, and strength, leads to increasing fatigue and risk for falls. Osteoporosis is lack of stress on that bone, causes an increase in calcium absorption, then the bones become weakened. The patient is at risk for pathological fractures. Now remember, contracture, decreased joint movement leads to permanent shortening of muscle tissue, resistant to stretching. The strong flexor muscles pull tight, causing a contraction of the extremity of a permanent position of flexion. One type of contracture is foot drop. When foot drop occurs, the foot is permanently fixed in a plantar flexion. Ambulation is difficult with the foot in this position because the patient cannot dorsiflex the foot. The patient with foot drop is unable to lift the toes off the ground. So what can we do? Exercises to prevent excessive muscle atrophy and joint contractures help maintain musculoskeletal function. If the patient is unable to move part or all of the body, perform passive range of motion exercises for all immobilized joints while bathing the patient and at least 2 or 3 more times a day. If one extremity is paralyzed, teach the patient to put each joint independently through its range of motion. Patients on bed rest need to have active range of motion exercises incorporated into their daily schedules. Teach patients to integrate exercises during ADLs. It will be necessary to assist patients with active and passive range of motion exercises to decrease the incidence of hazards of immobility. Stasis means inactivity. Gravity helps empty the kidneys and bladder. When a patient is flat in bed, urine can remain in the renal pelvis, which favors the growth of bacteria. This can lead to a urinary tract infection. Renal stones are calcium stones that lodge in the renal pelvis or pass through the ureters. Immobilized patients frequently have conditions that increase the likelihood of renal stones, such as hypercalcemia and concentrated urine due to dehydration. Decreased bladder muscle tone can result in urinary tension. Urinary catheters and inappropriate perineal care increase the risk of urinary tract infections. The changes in metabolism that accompany immobility add to the harmful effect of pressure on the skin in the immobilized patient. This makes immobility a major risk factor for pressure ulcers. Any break in the integument of the skin is difficult to heal. A pressure ulcer is an impairment of the skin that results from prolonged ischemia in tissues. Please don't forget about the psychosocial effects of a patient that is immobile. We know that there are sensory alterations, decreased social interaction, and that can lead to depression. They have feelings of worthlessness. They also are hopeless. Now we'll talk about Chapter 39, Activity and Exercise. Nurses often provide care for immobilized patients whose position must be changed, who must be moved up in bed, or who must be transferred from a bed to a chair or from a bed to a stretcher. The wider the base of support, the greater the stability of the nurse. The lower the center of gravity, the greater the stability of the nurse. Because people are not geometrically perfect, their centers of gravity are usually midline at about 55% to 57% of standing height. Flexing knees and hips lowers that center of gravity. Body balance occurs when a relatively low center of gravity is balanced over a wide, stable base of support and a vertical line falls from the center of gravity through the base of support. When the vertical line from the center of gravity does not fall through the base of support, the body loses balance. A physical therapist should be consulted to help choose the proper assistive device, fit the device, and instruct the patient on the correct technique. As a nurse, you will assist patients in using their devices correctly during ambulation. Crutches help to maintain balance by widening that base of support. Crutches are used by patients who must transfer more weight to their arms than is possible when canes are used. Walkers provide a wide base of support and the greatest stability and security during walking. A walker can be used by a patient who is weak, has a weight-bearing limitation on a lower extremity, or has problems with balance. A person's cane length is equal to the distance between the greater trochanter and the floor. A single straight leg cane is more common and is used to support and balance a patient with decreased leg strength. The quad cane, however, provides the most support and is used when there is partial or complete leg paralysis or some hemiplegia. The patient needs to learn that 2 points of support, such as both feet or one foot in the cane, are on the floor at all times. The axillary crutch is the most common crutch used. When crutches are fitted, ensure the length of the crutch is 2 to 3 finger widths from the axilla. Position the tips approximately 2 inches lateral and 4 to 6 inches anterior to the front of the patient's shoes. Axilla should not be supporting the patient's weight. Pressure on these nerves can result in partial paralysis of the arm. The basic crutch stance is that tripod position formed when the crutches are placed 6 inches in front of and 6 inches to the side of each foot. Remember, 4-point gait gives stability to the patient but requires weight bearing on both legs. Use a 3-point gait for non-weight bearing status on one leg. 2-point gait requires at least partial weight bearing on each foot. Individuals with paraplegia who wear weight-bearing braces on their legs frequently use the swing-through gait. Remember, when ascending stairs on crutches, the patient usually uses a modified 3-point gait. The patient stands at the bottom of the stairs and transfers body weight to the crutches. The unaffected leg is advanced between the crutches to the stairs. The patient then shifts weight from the crutches to the unaffected leg. Finally, the patient aligns both crutches on the stairs. The patient repeats that sequence until he or she reaches the top of the stairs. Up with the good leg and down with the bad leg. I'm going to advise when you're reviewing Chapter 40, the hygiene chapter, go back to that recorded Zoom that I did for this last week and review that again. And then for chapter 5, 16, 17, 18, I feel like it's hard to extract information from those chapters. So please go back and listen to those recorded lectures.